Hello and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Bower, the editor of GP Online. Today on the podcast, I'm joined by our deputy editor, Nick Bostock, to talk about some of the latest news affecting general practice. Coming up, we're looking at what's happened to the GP workforce over the course of the 5-year contract, in particular the number of partners. We're also talking about the cost to the NHS of not retaining doctors following some BMA research and the government's view of the workforce crisis. We're discussing the issue of drug shortages and how it's affecting GPs and patients, and we're looking at the government's plans to tackle the sick note culture that could see GPs lose their role signing fit notes and big changes to benefits for those with disabilities and long-term illness. A little bit later on, we'll be joined by our senior reporter Kimberley Hackett for our good news story about a crowdfunder that's raised money to support a popular local GP in her bid to keep her practice after it was put out to tender. That's all to come on this episode of Talking General Practice. First up, let's talk about the GP workforce. Nick, we talk about the GP workforce figures quite a lot on the podcast, but with this latest set of data that came out last week, we're able to get a picture of what's happened to the GP workforce in England over the period of the 5-year contract that was introduced in 2019. What did the data tell us about what actually happened over that period?
I don't think it'll surprise anyone who listens regularly to this podcast or who reads GP Online that the overall GP workforce has declined over the 5 years since that multi-year contract began in 2019. So between March 2019 and March 2024, general practice in England lost about 912 GPs. There are now just under 27,600 fully qualified full-time equivalent GPs in England, according to the latest figures, and that's about 3% less than at the start of the 5-year contract. Given that the government promised at the end of 2019 to deliver 6,000 more GPs, which was itself an update on a previous promise to deliver an extra 5,000 GPs, the fact that the fully qualified GP workforce has dropped over the past 5 years is a major failure for the government and for NHS England. As we've talked about before, GPs are delivering more appointments than ever. Numbers of patients registered with GP practices are higher than ever. So this depleted workforce is under huge pressure, and that pressure is actually exacerbated by the fact that GPs are also supervising large numbers of non-medical staff seeing patients in general practice, as well as a large rise in registrars. But alongside that drop in the overall GP workforce, one figure that really stands out from the past 5 years is the decline in GP partners, which you mentioned. As I said, the overall workforce dropped by 3%, but full-time equivalent GP partners dropped by more than 15% over the 5-year contract. So in March 2019, there were just over 19,000 full-time equivalent GP partners, and they made up just over 2/3 of the fully qualified full-time equivalent workforce at that time. But in March 2024, there were nearly 3,000 fewer full-time equivalent GP partners, just over 16,000 in total. I've actually done some more analysis this week on this for GP Online. We've got a map looking at how the reduction in GP partners varies between ICB areas across England. So anyone who's interested in finding out more might want to go and explore that. To sum it up, basically in some areas, the total reduction in partners over the past 5 years is absolutely massive. It's more than a quarter.
The fall in the number of partners overall is pretty staggering, although perhaps not really surprising. But it's worth mentioning this 5-year contract was really billed as an attempt to sort of stabilise general practice. The implication as part of that being that it would sort of stabilise the GP partnership model. We've also had the new to partnership scheme over that period, which offered incentives to GPs and other clinical staff to become partners. And clearly from these figures, that doesn't seem to have made any difference either. What's the impact of this falling number of partners?
GP partners are absolutely fundamental to the model of general practice in the UK. These are the GPs who hold practice contracts and run practices and are therefore the employers of GPs in other roles, salaried and locum GPs. A partnership review commissioned by the government, which was published at the start of 2019, so actually just before the 5-year contract began, said that some of the advantages of the partnership model were things like a freedom to innovate, relative autonomy in delivering patient care and the power to advocate for patients, accountability to local communities, and probably above all, value for money. It's often said that general practice runs off the goodwill of GP partners because they don't clock off when their working day ought to have finished or when they've seen the last patient of the day. They clock off when the work is done, meaning they often work long hours into evenings and weekends to finish off paperwork and tasks that are essential to running a practice and keeping patients safe. It's worth mentioning here that obviously has a toll on GPs in terms of burnout. But one GP said to me a few years back, when there were rumours swirling about the government wanting to scrap partnerships, that if the government went down that route, general practice would collapse pretty much overnight without the backstop that partners provide. But obviously as well, like I mentioned, from a burnout point of view, partners' goodwill is being tested to the absolute limit at the moment, because as we've said before, the BMA says GP practice funding has been cut in real terms by more than 50% over the past decade and a half. That's squeezing, obviously, the amount of income that partners can earn from their practices, and obviously the income they have available to pay staff. And polling shows partners lost 20% in income over the past year, and this year's contract is another really big financial blow to them. That financial pressure is driving partners out, along with the heavy workload I mentioned a moment ago that's affected all GPs. And we know that the number of GPs working full-time has dropped by 20% under the 5-year contract, so that figure will be reflected in the full-time equivalent partners total. And the closure and merger of practices is another big factor. The number of practices in England fell by nearly 10% over the course of the 5-year contract. And each time a practice closes or merges, it's likely that GP partners go with it. And as things stand, the imposed contract for 24-25 isn't going to help. The BMA says it's going to drive more practice closures, and that means obviously yet more partners lost. In terms of what the rapid erosion of GP partners means for general practice and the wider NHS, I mentioned, if it's allowed to continue, it's likely to mean general practice will become much less cost efficient, because fewer and fewer GPs will have a role in the business side of the practice they work in. And that means potentially higher costs for the NHS and a worse service for patients.
The other thing the 5-year contract did as part of the attempt to stabilise general practice was pumping huge amounts of additional funding. By the end of that 5 years, well over £1 billion a year extra into primary care each year. But nearly all of this money has gone into primary care networks and the additional roles reimbursement scheme, hasn't it? And we can obviously see the impact that's had. We've talked about that in recent weeks on the podcast.
Yeah, so the 5-year contract promised extra investment to stabilise general practice, but a lot of the new money that came in has been tied to PCNs and in particular to the additional roles reimbursement scheme, the ARRS. A total of £1.4 billion a year is now attached to that scheme. That's brought in thousands of non-medical staff into general practice. But that money can't be used to recruit GPs, and at a time when core practice funding has been eroded massively in real terms because costs have gone up far faster than funding, that's helped push general practice towards this situation we've discussed before on the podcast, where GPs are struggling to find work because practices just can't afford to recruit them. The chair of Liverpool LMC, is Dr. Rob Barnett, told me this week that the 5-year contract was sold to the profession on the basis that it would bring more resources into general practice. But basically, all that money has gone to completely the wrong place because it can't be used to hire GPs and practice nurses, which are precisely the staff practices are crying out for.
Yeah, so we know we're losing GPs, but there are problems with retention elsewhere in the medical profession. The BMA put out some figures last week looking at the cost to the NHS of not retaining the doctors we already have. What did that find?
The BMA says somewhere between 15,000 and 23,000 doctors left the NHS workforce prematurely in the year to September 2023. And obviously losing those doctors before they reach retirement age means large amounts of money the state invested in training them is not delivering as much as it could have done. And it means that there's an additional cost to bring in staff to replace those doctors who've left early. The BMA says replacing these doctors will cost the health service between 1.6 billion and 2.3 billion a year. And it says that because rising numbers of doctors are leaving the workforce early, the health service could soon face a bill that goes up as high as £5 billion a year because of its failure to retain the medical workforce. And that obviously adds some interesting context when it comes to thinking about the logic behind the government's refusal to reverse the erosion of doctors' pay over recent years. The government says it can't afford to reverse big real terms pay cuts for doctors, But these figures suggest that maybe it can't afford not to.
That's a good point, isn't it? Those are staggering amounts of money, really. You looked at some of that data and you managed to work out some figures related to the cost of losing GPs specifically as well, didn't you?
I can't actually claim to have done the maths on that myself. I went back to the BMA after reading the initial report, and they supplied some GP-specific figures. The authors of the report estimated that when it comes to failing to retain GPs, costs could come to around £356 million a year. And again, in the context of the profession currently being in dispute with NHS England over a sub-inflationary contract uplift for this year, that's a powerful argument that putting more money into the contract is not only justified, but crucial.
We've talked at length here about the terrible state of the GP workforce, but we do have record numbers of doctors in GP training at the minute, don't we? I mean, the Health Minister, Andrea Leadsom, made some quite bold claims, some might say quite misleading claims, about the GP workforce in Parliament last week that was very much based on those GPs in training, didn't she?
Yeah, so I mentioned right at the start of the podcast that the GP workforce had dropped by just over 3% over the course of the 5-year contract. So that's from the end of March 2019 to the end of March this year. But Andrea Leadsom, who's the government's primary care minister, said in Parliament last week that there are 3,000 more GPs now than there were in 2019. She said GPs, but the figures she relied on to make that claim include GP registrars. So those are doctors who are training to become GPs, but who are not yet fully qualified GPs. In the past, the government's used slightly more careful language to make sure it can include GP registrars in the figures it uses on the GP workforce. The 2019 Conservative Manifesto, for example, promised 6,000 more doctors in general practice rather than saying GPs. Registrars can be counted technically towards that total. As you said, there are record numbers of doctors in GP training at the moment. Training places are up to 4,000 a year, compared with around 2,500 a decade or so ago. And that means there are a lot more of these doctors in practices around England, and they are contributing significantly to the workforce in general practice. But the claim that there are 3,000 more GPs now than in 2019 is clearly at best misleading. It's also worth noting here that less than 2 in 5 current GP registrars say they plan to work in NHS general practice when they complete their GP training, according to BMA surveys. So that's another massive reason why counting these doctors as if they are already GPs, already part of the NHS GP workforce, is just not realistic. On another point related to this, we also reported this week on registrars worrying that they won't be able to find work in general practice when they qualify. We've talked about GPs struggling to find work generally, and for the cohort of registrars who will complete their training at the end of this summer, coming into a workforce at a time when some experienced GPs are already unable to find jobs because practices just can't afford to recruit is understandably hugely worrying.
Next, we're talking about drug shortages. Nick, we did a survey recently that asked GPs about their experiences of drug shortages and the impact this has had on them and their patients. This is a question we regularly ask GPs in our surveys because we know drug shortages are becoming increasingly problematic and take up a huge amount of GP and practice time. What did this latest survey find?
Our survey found that more than 9 in 10 GPs have had to prescribe second-choice drugs in the past year because the one they wanted to prescribe wasn't available. And a quarter of GPs who had to do this said there was an adverse effect on the patient as a result. More than 9 in 10 GPs also said drug shortages had got worse over the past year, which reflects other evidence that we've reported on. In addition to adverse effects for patients who had to switch medication, GPs said medicine shortages are adding to already really heavy workload in general practice, because of the extra time and paperwork involved in switching prescriptions. Some GPs said medicine shortages were now so bad that they were causing problems on a daily basis. And in some cases, they said no alternatives were available to the drug that they wanted to prescribe to a patient, which meant that the patient ultimately is left without treatment. We've talked before about evidence that levels of abuse practices receive from patients are rising. And GPs said that medicine shortages were often a trigger, with patients taking out their frustrations on practice staff when they weren't able to get hold of medication or the medication that they were used to wasn't available.
There's no excuse for that, but it must be terribly stressful if you rely on a medication that you can't get hold of. There are record numbers of drug shortages at the minute, aren't there? We know this because our sister site MIMS runs a drug shortages tracker, which is very popular. How many items are currently on there?
So when MIMS launched its tracker in 2019, there were about 100 products on its list as out of stock or unavailable. By last October, that figure had risen to around 180, and Kimberley wrote about that at the time. It's actually come down a bit since then, but there's a really large number of products that just aren't available at the moment. And GPs who took part in our survey gave examples of some of the medications they've really struggled with, including products for HRT, ADHD, osteoporosis, antibiotics, some strengths of statins, insulin, nasal sprays, GLP-1 injections, and some others.
Yeah, I mean, some of those drugs I know are causing really serious problems. But our survey results come out as the Nuffield Trust published a report a couple of weeks ago on the future of health after Brexit. And one of the big issues that report looked at was supply of medicines. What did the Nuffield Trust find about that?
Basically, it said that constant medicine shortages were becoming the new normal, which pretty much seems to reflect the impression we got from GPs responding to our survey. The report said the shortages were causing problems for patients, adding to GP workload and workload for pharmacists, and also driving up costs for the NHS. The rising cost is linked to a sharp jump in price concessions. So it's basically when pharmacists say they can't obtain medications at standard prices, the NHS has to agree to increased reimbursement for them. And the Nuffield Trust report suggested this had cost an extra £220 million in the year to September 2023 alone. An interesting finding from this report, I mean, you mentioned Brexit, and the report found that Brexit had an impact. It said that the UK leaving the EU had contributed to problems with medicine shortages by lowering the value of the pound sterling and removing the UK from EU supply chains. And it said that down the track, Brexit means the UK could be left out of EU measures that are intended to respond to drug shortages through actions such as shifting medicines between member states, buying products jointly, and also trying to bring manufacturing back into Europe.
That's quite worrying, the prospect of all of that drug shortages could potentially get worse. It is a global issue and countries around the world are going to be looking at solutions to solving this problem. I mentioned the MIMS drug shortages tracker earlier. You can see that if you want to look at it. You can get that by subscribing to MIMS, and you find more information about that at mims.co.uk.
Last week you wrote a story about government plans to reform the welfare system and proposals that could see GPs lose responsibility for signing fit notes. So what's the plan with that?
Yeah, so people will probably have heard a bit about this because it got a lot of coverage in the media. So this is a speech that the Prime Minister, Rishi Sunak, made 2 weeks ago now, where he set out a range of measures to tackle what he described as the sick note culture. These are all steps that are aimed to cut the number of people claiming benefits and get more people back into work. There were a number of measures announced around this, but 2 of them are directly relevant to general practice. One relates to possible changes around fit notes, and the other is proposed changes to the Personal Independent Payment, or PIP, which is a cash payment that people get if they need help with daily activities or mobility because of long-term illness or a disability. It's basically what used to be disability benefits. These plans were trailed actually in the Chancellor's spring budget back in March, and really they've been thought up by the government because figures show that a record number of working age adults in the UK are out of the workplace at the minute. And this is a number that has risen sharply since the pandemic. And the government is very concerned that this is affecting economic productivity in this country. So basically it wants more people to get back into work. Obviously, there are all sorts of reasons why people are out of the workplace, including, choice, caring responsibility, childcare costs, for example, not just ill health and disability, but that's the backdrop for these proposals.
So what's the plan with fit notes?
So Rishi Sunak has announced a review of the current system. He said that 11 million fit notes were issued last year, and that's actually the figure for 2022-23 that year, and only 6% of those were signed as maybe fit for some work, which he basically said was, and I quote, not right. Obviously, the implication there is GPs are signing too many people off work sick He tried to downplay that by saying it wasn't reasonable. He says it's not reasonable to ask GPs to assess whether their own patients are fit for work because it puts them in a difficult position with patients who want to be signed off. But again, that's really assuming that big numbers of these fit notes are being doled out inappropriately. And really, it's not at all clear that that's what's happening. Also, that 11 million figure is potentially a bit misleading because it doesn't really quantify at all how many of those people are being signed off for a couple of weeks and how many are off for longer periods. Anyway, what's the government plan? So firstly, it's launched a call for evidence on how the fit note system should be reformed. But essentially, what the government is proposing is that responsibility for fit notes will move away from GPs to what they call health and work professionals. The government says this will free up GP time, which, could be a positive, and certainly some GPs will welcome that. But essentially, I think it's fair to say that the government thinks that this new system will mean more people are given a note saying they're fit for some sort of activity. So they're going to pilot this new approach in a number of integrated care systems, and it looks like this is going to happen in the ICSs that become what's known as work well vanguards. So this scheme was announced last year, and the selected vanguards are due to be announced imminently, any day now, basically. ICSs have had to bid to become one of these vanguard sites as part of a separate process, and there's apparently going to be about 15 of them. Those vanguards will be looking to pilot ways to join up health and employment support services much more widely. That was the initial idea behind them. And there's already funding earmarked for that. And it looks like these sites will now get additional funding to pilot this new fit note system. And under this system, people who need a note will apparently be assessed, have a work and health conversation with these new work and health professionals, who will be a mix of clinical and non-clinical staff who will have extra training to conduct what the government calls robust and in-depth work and health conversations. But it's not really clear how people will access this new system. The Times reported that there could be some sort of AI-led triage that will be at the front end of all of this, but that's not been confirmed. Whatever they do, it's quite difficult to see how GPs or practices can be removed from the process entirely, though. But maybe that's one of the things these pilots will be trying to sort out. So those pilots, that call for evidence, will eventually shape what the final plan for fit notes will be. But clearly that's all going to take quite a lot of time, and really by that point we could have a different government. So whether any of this becomes a reality is a bit of a moot point, really.
Yeah, I noticed the Conservative MP Luke Evans, who's a GP, mentioned in Parliament that he was personally up for this closer link between the DWP and healthcare services and general practice.
The RCGP has also backed the idea of the consultation. Definitely think that's a good idea to look at who's best placed to issue fit notes given the current workload pressures in general practice. But it's pointed out that any changes need to be properly piloted and evaluated to make sure there's no unintended consequences. But obviously, these work well vanguards, they could be a good thing, because the problem GPs have at the minute is often, there might be some things that people could potentially do in work, but if you've got no decent occupational health service or employment support service to refer people onto to help sort that sort of problems out, then GPs are a bit hanging in limbo, really. So maybe these sites can come up with something that means that system could work much better and take pressure off GPs. So it could potentially be a positive thing.
And then what are the PIP changes?
Well, this is the bit that's potentially more controversial. The government is suggesting a big overhaul of the way PIP is assessed. And from everything that's been said, there will be a particular focus on potentially cutting the levels of benefits that people receive if they're getting PIP as a result of a mental health condition. Rishi Sunak said in his speech that the government would be more precise about the types and severity of mental health conditions that qualify for PIP. And just as an aside, some of the rhetoric around mental health conditions linked to this has been really, frankly, very disappointing to hear. It's taken so long to get to a point where mental ill health is taken as seriously as physical ill health. And some of the comments from Rishi Sunak and Mel Stride, the Work and Pensions Secretary, have really felt like a massive step backwards on that front. And that includes comments they've made about fit notes being issued for mental health conditions as well as the PIP changes. But anyway, this week we saw a bit more detail on what the plans are for PIP. At the minute, PIP uses what's called a functional assessment to decide whether people are entitled to support. So assessors who work for companies like Capita and Serco look at 12 daily activities and how someone's disability or health condition affects their ability to do those things. And the DWP uses those assessments to decide on eligibility. What the government is proposing is removing these assessments altogether for certain conditions or disabilities, and instead using a clinical diagnosis from a healthcare professional, or in some cases potentially using a clinical diagnosis to decide which people qualify to have a functional assessment. The concern for many people is this could eventually mean there's a list of conditions which you can get help for, a list of conditions which you can't get help for, and without any recognition of the impact an illness or disability has on someone's life. There's also a worry this could place more onus and work on GPs and other healthcare professionals, and the government says it's mindful of that, and that's one of the key issues it's going to be looking at as part of a consultation that it launched this week. The government also wants to change the way payments work, so instead of giving people ongoing payments, some people might get one-off grants, other people might get vouchers towards specific costs, and some people might get no money at all and instead get, and I quote, improved access to treatment. So there's been a lot of objections from disability groups about those specific proposals, and the statement, particularly around getting vouchers instead of cash payments, so, taking people's agency around how they need to use the money to help themselves. And that statement about improved access to treatment just seems to make no sense at all. I mean, someone needs treatment, surely they should just get it, regardless of anything else. But it could be that GPs actually end up with a bigger role to play in this new system. In the consultation, the government highlights a model from Norway as a possible example of where things could go. And in that system, people need to provide a letter from a GP outlining their condition and the associated costs in order to get benefits. But I think it would be very difficult to expect GPs to play a bigger role in any new system, given the current pressures in general practice. But again, as I said earlier, overhauling this system is a massive job that will take a long time. So whether any of this actually happens, given a fairly imminent general election, remains to be seen.
You've covered some of the reaction to this, but what's the wider reaction been?
Yeah, quite angry from some quarters. I mean, the BMA basically says that the possibility that people suffering from poor mental health could have their benefits removed is cruel and would likely to be ineffective. I think I touched on there earlier. Charities and campaigners really angry. They've accused the government of using mentally ill people, sick people and disabled people as a political football. The BMA, I mentioned the RCGP earlier, the BMA have also pointed out that while changes to the fit note process could help free up GP time, which we talked about, which could be good, the real problem is that there are basically record numbers of people on the NHS waiting list, and perhaps the government should be focusing on sorting that out to cut the number of people signed off sick. And that's the rub, really, isn't it? I mean, no one's denying that there's a problem here. You just have to look at the figures. For PIP, there are now over 33,000 new awards per month compared with 17,000 before the pandemic. So that's doubled. Meanwhile, that 11 million fit notes issued that I mentioned earlier for 2022-23, that's up from 5.2 million in 2015-16. So obviously something's going wrong. But clearly, there are reasons why there are record numbers of people signed off sick or needing to claim benefits. GPs and health professionals listening to this, will know only too well the toll the pandemic has taken on people's mental health. The cost of living crisis has driven more and more people into really very precarious financial situations, which can have a devastating impact on their mental health. Mental health services are massively oversubscribed, so many of these people are just not getting the help they need. And then obviously millions of people on a waiting list to treat physical problems, which means they may need to be signed off or apply for PIP. And then long wait for treatment can also lead to mental health issues. So it's not surprising that there are more working age adults out of work when you think about it. So what we probably really need is some kind of approach that looks to tackle some of those issues. But obviously doing that is a lot harder than announcing an overhaul on benefits.
Yeah, it's all obviously a massive driver of workload in general practice, the size of the waiting list and all the rest of it. So GPs would very much welcome some kind of major initiative to crunch through that wait.
On saying all of that, though, so like we have talked about, there could be some positives that come out of it. We could end up with a better system for doing fit notes, as I mentioned earlier. Likewise, some of the changes proposed to PIP are potentially positive. For example, some of the changes the government suggested will probably make it much more straightforward to get financial help if you have a terminal illness, for example. And that's obviously a good idea. So it's not all completely terrible. And again, that consultation could unearth some better ways to do things. But obviously, campaigners and doctors are, in my view, quite rightly worried that some of the suggestions that are currently being proposed by this system seem to be overly punitive and potentially be bad for people's health in the long run. Before we go, I've just got time for our good news story, which this week is about a campaign to keep a GP running a local surgery. So I'm just going to introduce our senior reporter, Kimberley Hackett, who's been following this story over the past few months. Kimberley, we've been writing about the patient-led campaign to save the local GP at Withnell Health Centre in Lancashire for a while. What's the background to this?
So we need to head back to 2021 when one of the practice's 2 GPs dissolved the partnership and left. It meant that Dr. Anne Robinson, who has worked at the surgery for 11 years, was left in charge on her own holding an interim APMS contract. Next, against the practice's staff and patients' wishes, the Lancashire and South Cumbria ICB decided to put the practice out to tender. Dr. Robinson was up against SSP, a company that calls itself the largest provider of primary care GP services in the region, and the contract was then awarded to SSP. And it was this decision that sparked outrage from patients and staff, and the practice's PCN even said it would not accept SSP into the network. Then in February 2023, the ICB announced it decided to abandon the procurement process, and they admitted that the patient engagement was not thorough enough. It meant that Dr. Robinson was able to keep running the practice for another 18 months on an APMS interim contract. But fast forward to March 2024, and the ICB once again announced that it would put the practice out to tender.
Yeah, I know that patients are not that happy about that, are they? But what's the latest development that's made it our good news story for this week?
So after the ICB's latest announcement, one of the practice's patients took matters into their own hands and launched a fundraiser to help Dr. Robinson keep the practice. At the time of recording this episode, £6,920 had been raised, well above the £5,500 target. In fact, a staggering £4,000 was raised in just 4 days, and the largest single donation stands at £1,000. I think this really shows how much the patients value Dr. Robinson and the practice staff who serve the local community. Comments have been left on the fundraiser page championing Dr. Robinson and wishing her luck. There is even a donation from another GP who said they are backing the traditional practice model instead of large companies taking over. Now, the money will be used to pay for bid writers to work with Dr. Robinson on her new application to run the practice. Last time, Dr. Robinson lost out by only 3.5 points, so the hope is that with the help of professional support, she stands a better chance of winning the procurement. You really could hear the emotion in Dr. Robinson's voice when I spoke with her about the fundraiser. She told me she was overwhelmed and humbled by people's generosity, especially considering we are in a cost of living crisis. I mean, it's really no surprise she feels this way, having already spent £40,000 of her own money seeking legal advice on the outcome of the first procurement process and didn't take a salary for 6 months as a result. Word about the fundraiser has spread, and one bid writer has even offered their services for free. With the money raised, the practice has accepted help from 3 bid writers, and Dr. Robinson says she now feels more optimistic. Louise France, who launched the fundraiser, told me she set it up because she couldn't bear the idea of Dr. Robinson losing any more of her own money, but also because she is worried that the practice will lose what she described as an incredible service offered by Dr. Robinson.
Yeah, I mean, that is a really great story. I mean, obviously, we'll be following what happens there, and hopefully there will be some good news and another good news story to report on the outcome of all of this. Fingers crossed. Well, that's it for this week. Thanks for listening, and thanks so much to Nick and Kimberley. If you're enjoying the podcast, please do think about giving us a rating and leaving a review. It really does help us out. I'll be back next week when I'm speaking to Dr. Victoria Giorgio-Brown, Vice Chair for External Affairs at the Royal College of GPs, about achieving parity for general practice, why it's important, and the change the college wants to see to make it happen. So please do join me then. In the meantime, you can keep up to date with all the latest news affecting general practice on our website at GPonline.com.